Good morning and welcome to Skeletal System. In general anatomy, today we'll be talking about skeletal system, the bones. Now, as usual, before we really start with that, say our respects to Henry Gray, right? He is the person who actually started the anatomy in a very, very interesting way. Right? And that's the Gray's Anatomy, which is considered as a very good reference book. Few important answers for the email. Remember, in nutshell, still the questions are coming about USMLE Next and PLAB. USMLE is for if you really want to practice in USA plus other countries, right? One thing is very clear: if you don't want to go to US, you want to practice and do PG in India, then you have to do next only, that is national exit exam. You don't have to appear for USMLE. But if you have cleared USMLE, then you can practice in India. I hope I'm clear, right? Next is only for practicing in India, India and India only, right? It is India only. Next exam is not valid, right? It is not valid in USA. Fine. Okay. Regarding the PLAB, PLAB is for UK, Switzerland, right? It's for them. Again, say appearing in next won't permit you to practice in UK or USA. I hope I'm very clear, right? So the question which is asked again and again, I want to practice and do PG and practice only in India. Well, gentlemen, in that case, only next is sufficient. Okay. Regarding time management, procrastination, so many emails. So sure, Saturday would be the day on which we'll be talking at length about this, right? Regarding which books to purchase, I told you, right? Even it is over there in the last PDF, it has been mentioned, right? So I have written about it. In nutshell, B.D. Chaurasia, Inderbir Singh and the Cunningham, they are actually sufficient books to start with. Sambulingam for physiology is very good. Guyton is fantastic book. You can definitely keep it. It is not that expensive, but yes, it will make your concepts very good. Obviously, which edition? You will always be going for the latest edition, right? So regarding time management and procrastination. Well, don't worry about the rotation, etc. Right? It will, in any case, so many things will come today. Uh, Regarding screen addiction and the question, almost 4-5 emails about screen addiction and are serials or movies so bad? Well, I'm not telling that they are bad, right? But give yourself a justification. Think about it, that if it is showing so much of violence, if it is distracting you after watching that, right? After watching those serials or watching those movies and watching so much of violence and bloodshed, if you can't even sleep properly and if it is disturbing your studies, definitely they are not worth watching it. They'll keep on showing you all such things because they really want to increase their TRP. So that's in nutshell. It is like I can't force anyone what to watch and what not to watch, but I think you are intelligent enough to decide where you want to restrict yourself, right? What to do in between studies if not watching these screens? There are so many things, right? If you are alone in the room, put a music and dance, right? Literally freestyle dance. Try to do it once. Do it for only 3 to 4 minutes. It's not only a good exercise, but you yourself will feel so good. You yourself will feel so good. If you want to sing, forget about whether you can really sing or not, right? You don't want to say enter into any of the competition. You're singing for yourself, you are playing for yourself, you're dancing for yourself. Do it, right? Eat something healthy in the form of fruit, right? Have a fresh lemon juice, If you feel like, have black coffee, right? Now these are the things where your brain would really love it. So that's how you go ahead. These are some of the options regarding anxiety and depression. Yes, on Saturday we'll be talking about it, right? Anxiety, depression, all and the time management, because as such they are internally related to each other. So wait till Saturday. Okay. Regarding height increase, yes, you start doing stretching exercises, and today you will be getting the answer when we'll be discussing the bones, especially in the form of diaphysis and epiphysis, and what really happens to that, right? I told you today's topic is skeletal system. Regarding disturbed sleep or not happy in the morning, that is maybe cut the screens, cut the screens, stop watching all those serials, right? And as I said, just before you go to sleep, so many positive emails were there that just before you go to when you were going for sleep, you revised that PDF, and in the morning once again you revised it, and since 2 days you are feeling happy. Try to do that, right? Because that would matter a lot. That's your sleeping hour, right? Before you go to sleep, revise. As soon as you wake up, revise and see the difference, right? Say there is nothing like it. It varies, but usually 16 to 18, right? 16 to 18. But say some people, they walk with this posture as if the back is bent. If you start walking with your straight spine, right, like an army, automatically your height would look better, right? Say if it is restricted, if it is stopped, so obviously you can't add 6 inches to that, but still your personality matters. Okay, right, Siddharth. Regarding earn money, regarding say earn money, don't worry. Say earning money from internet, right? It is not that easy. There is so much of competition, and at this point of time, surely I would say not to say be say deviate yourself after watching certain videos, because there are so many videos where they say okay, earn $1,000 within this time and that time. No, had the things been so easy, right, everyone would have done that. So focus on your studies. Once you'll be master, look at the long term things, don't look at the short term, right? You'll be, yeah, all those dream 11 and this or this, all bakwas, right? Literally bakwas. Don't even get involved into that. They give you the warning. Part-time job, once again I'm telling you, think it like that. Is everything coming at the cost of your studies? Then it is not worth. uh, Today's skeletal, yes, even if you have missed yesterday's lecture, nothing to worry. Wherever there would be any doubt, right, just let me know. If there is any doubt, let me know. I'll explain to that context. So every lecture would be like an independent thing. Okay, stop this rummy and all those things, right, please. So that was the point. Regarding this wdoms.org, still so many emails they are coming up. So that's why I thought that let me clarify it. Say the question which was asked, is my college registered? So all you need to do is say, if you feel like my college is not registered, right? Say for example, say Kazakhstan, right? And so why to enter into such complication? Simply, right, Kazakhstan, let's say your city is Almaty, but even if we don't look at it, straight away Kazakhstan and search, right? And see, here is your college, Kazakh Russian Medical University, right? That was the question. I think you are there, right? So over here, if you write it like Kazakhstan space Russian, so you might not be able to get that answer. So simply just search the country and watch it in the list and you'll get the answer, right? So I hope I am clear in that and your question has been answered, because there were 4-5 emails on this. And And finally, this facing insults. Why are you facing any insult, right? Why you are forcing me to speak that word again and again, right? Forget it is yes. The question which you asked is, I'm answering point blank. Yes, if someone is insulting you in such a way, right? No worries. You can simply say goodbye for such relations, right? There is no harm. You are important, and once you will be reaching to those great heights, right? Once you will be the finest of the doctors, you'll be having much better options, much better options. Okay. Regarding this weight and all those things, we'll be dealing on Saturday. That's what I said. Right now, don't even ask about such questions, right? Send a mail and we'll cover everything on Saturday, right? Okay. Now let's start with our today's topic, and today's topic is skeletal system, right? Skeletal system. Say all those things regarding anastomosis, flexion, extension, etc., because you can watch that video again, and still if there is any doubt, right, send a mail. Okay, because right now, in benefit of everyone, we need to focus on the topic, right? Otherwise we'll miss, and others would deviate. So here it is in the skeletal system. Skeletal system, this is like when we are dealing with bone and cartilage, right? Simple as that, bone and cartilage. So bones, they are a sort of connective tissue, right? They are sort of connective tissue. So not only like muscles or skin, etc., but this bones, they are also sort of connective tissue. But the only thing is that they are pretty hard, right? They are pretty hard. And why they should be hard? Because of those calcium salts, right? Because of calcium salts. These are all inorganic salts. So calcium phosphate, right? Calcium phosphate, so important. Calcium carbonate, so important. And whenever you find, say for example in radiology, right, you watch the x-ray and you see osteopenia. Osteopenia is thinning of the bones, right? So let's have a new word, osteo means bones. So osteopenia, thin bones, thin bones. How will you see the thin bones? Well, I'll show you the x-rays when we'll be dealing with radiology. But right now, a very simple thing, tough, fine bone, that would be watched as a very white, proper shadow, right? If the bone is thin, obviously it would be blackish, right? And I'll show you both the x-rays, right? Normal and abnormal when we'll be watching it. But if that is the case, go for checking of the serum calcium, right? You'll check the serum calcium. Now, serum calcium will always be requiring along with the vitamin D3. So check both the things, right? And once you check, and then accordingly you can guide the patient what to take, what to do. Yes, if the bones are not strong enough, obviously it would affect its growth, and that is what we'll see today. Okay. One very fine thing about bone is that there is constant changeover, constant turnover, right? It is called as the constant turnover. Constant turnover means bone is getting resorbed and it is forming, right? Constant turnover of calcium. That is the reason that if there is any fracture, right? If there is any fracture. So when we write fracture, but medically, when you'll be writing fracture, you'll be writing it like that, right? This is not hashtag, right? This is the symbol of fracture. So if it is to be written like, say, fracture right clavicle, right? That's clavicle. Over here, the bone which is, that is clavicle. So fracture right clavicle. So that's how it is written, right? So that is the symbol of fracture. So that fracture heals, right? When we'll be discussing fracture, so there is open fracture, closed fracture, right, etc. But when two bones are, when a bone is broken into two parts, and when they both are kept together near each other, which is called as reduction of fracture, reduction. That means those two broken pieces, they are held together, and yes, by the grace of God, that thing would automatically heal and it will become one part. It's possible only if there is constant growth, right? So this is where there is constant growth, right? It heals, it changes its shape. That's why shape of the bone changes. So it molds, how it changes shape. We'll see it in more detail by the various types of pressure. And say one what is called as the atrophy. Atrophy means when the size is reduced, right? Reduced size. Hypertrophy, right? When the size becomes bigger, right? It becomes bigger, right? So that is how this entire system, it really works, right? Fracture, growth, molds, atrophy, hypertrophy. So this tells you one very important thing. Bone is something, if someone tells you, right, that अरे don't run, क्यों? Because knee joint घिस जाएंगे, your knees will be eroded. Now tell them that they are the biggest, most stupid people on this earth. Mold means changing the shape. It changes the shape, right? Mold means changing the shape. Okay, coming to that. So when you put pressure, right, bone grows, right? So when you are running, when you are putting pressure on it, so it becomes more and more powerful. So this is the reason that those who are marathoners, you'll never find that they are going for knee replacement. Knee replacements, that it goes for only those who are malnourished and those who are couch potatoes, right? Watching chips and watching the match, eating chips and watching the match, right? So it's never so that by doing exercise your bones will be eroded. No, it's not so, right? Bone has got tremendous regenerative power, tremendous, and in fact it is best amongst all the tissue. There is only one tissue which is better than bone, and that is blood, right? Blood regenerates much faster, but apart from that, say regenerative power is great, right? In case of bone, blood, it is the best. So this tells you that, say, we talk about that on skin, there is some injury and then gradually it heals. Boss, your bone is much more powerful. It would heal, it would regenerate more effectively, right? That's the beauty of the bones. And because bone is giving you the structure, your real structure, on stage, right? On stage, if you are supposed to speak, right? When you know that, okay, more than 2000 eyes are watching you. So at that point, your body posture, your body language, right, how you walk, that is vital. For that strong body posture, for that strong body language, right, it is your skeleton that should be powerful, right? Your skeleton should be powerful. Regarding how bones generate, right, that is the entire ossification process, etc. So when we'll be going into that detail, we'll talk about it. So of a cliff and his vertebral column is dislocated, can that be cured? Well, I need to see the x-ray. We need to see the x-ray, whether it can be cured or not, whether there is any wedging, whether there is compression of any of the nerves. So there are so many factors. What has happened to intervertebral disc, which vertebra is damaged, because if there is damage to say cervical, so then it is a big problem. Where if it is thoracic, so then things are okay. If it is lumbar, so then person would be having back pain, but can at the same time, if the nerve compression is there, can develop sciatica, etc. So we really need to see which vertebra is damaged and how much it's damaged. Pratik, stop putting such questions, right? It's disturbing. Don't do this thing. Anyone from this or anyone from that, no, don't do this. So on stage, your body language is important, and that's why your skeletal system should be awesome. Okay. Now let's see how many bones are there, right? This is in general, right? Bones of the entire body, right? We'll see. So that you have got a general idea. Is serum calcium vitamin D3? Means these are the two reports. Vishwara, there are two reports. Serum calcium is one report and vitamin D3, that is a second report. But both of them, they are needed for the health of your bones, right? They both are important. Okay, let's put one our skeleton. Okay, here it is. So instead of listing that this is, there are so many bones in cranium and so many bones in face, let's see it over here. So it will be more digestible. We'll be able to understand it more effectively. At the same time, I'll keep on telling you, serum calcium, it is just a blood report, right? In your blood, how much calcium is there? Right? Because whatever the amount of calcium is into the blood, when it goes to tissue, right, that is what is called as interstitial fluid. So your tissues, they will be absorbing that nutrient from the blood, and then that's how they will really utilize. Just because you have asked, so let me deviate slightly in the form of, let's say we measure blood glucose level, right? Blood glucose level. So in blood, the blood glucose level says that finger is pricked, and then with that strip, blood is picked up and then put it into glucometer, and we figure out that what is the blood glucose level. Now there is something which is called as the CGM, continuous glucose monitoring. These are the sensors. These are the electronic sensors which are put into the skin, right? There is a sort of gun, you just fire, and then that sensor, it sticks to the skin, and a very fine needle, it enters into the tissue. Now what these sensors they are doing, they are checking your interstitial fluid. Interstitial fluid. So this is a fluid which is actually giving nutrition to your tissues. So there would be the difference between the amount of blood sugar, that is the level of blood sugar, and the amount of sugar into the interstitial fluid, right? There would be a difference. So when we are taking the blood, right? So it means how much blood is into the, how much calcium is into the blood, right? That is what is called as the serum calcium. So this is just that these are the various types of fluids, because when we'll be discussing fluids, all these things would be, say, dealt in a greater detail. But time to time, I'll keep on telling you about such words, so that those words, once they enter into your mind, right, next time when you'll hear, you'll find that thing more familiar, right? Okay, so let's go back to our friend, our skeletal system, right? So here is, this is, right, this one, right? It is called as the cranium. Cranium, who is holding our entire brain, right? Very important. So there would be 8 bones, right? Right now, don't worry about name of all the bones, right? We'll not be worrying about it, right? That's okay. It's the name, they are quite logical, that frontal and occipital, etc. But when we'll be discussing the skull, when we'll be talking about head and neck, at that point, it would be in more detail. Right now, we are focusing on skeletal system. So then this is like face, right? Facial bone. Now see, 8 means 4 left, 4 right, that way, correct? For the face, there are 14 bones. 14 bones. Then one bone over here, and that, you know, that is what is called as the hyoid bone. Now this is a mix of all the bones, because today we'll be watching the classification of bones, and it is at that point we'll start deciphering that, okay, this is a long bone, this is a flat bone, this is irregular bone, right? Or it is at that point when we'll be deciphering it. Then, so cranium, face, hyoid. Then in the ears, in our ears, right and left, right? Ear is divided into 3 parts. One is external ear, what we see, right? Then there is the middle ear, and then there is inner ear. So idea is that when these sound waves they come, right, there are three bones. There are three very delicate bones. They are called as the auditory ossicles. They are called as auditory ossicles. Ossicles means these are very small bones, extremely small, right? And their name is like malleus, incus, and stapes. Malleus, incus, and stapes. So three bones on both the sides, right? Three bones on both the sides. So 3 into 2, that is 6. So that's why I'm writing 6 over here, right? So 3 into 2, 3 on both the sides. These bones, they are literally beauty, right? When we'll be talking about it, that how that कान का पर्दा, that is what is called as the tympanic membrane, when it vibrates, so it vibrates malleus, then that thing is transmitted to incus, and then it goes to stapes. In stapes there is a small window, right, on which that stapes attaches, and it vibrates. So when it vibrates, so there will be vibration in the fluid, which is the inside fluid, into the inner ear. So that fluid, when there are waves, so there will be few, those cilia, they will start moving. When they will start moving, they will send the impulses, they will generate electronic impulse. Those impulses, they will reach to the auditory system, right, into the brain, and it will analyze, and it will say, okay, this is what the meaning is, this is actually what is happening right now. As you are listening to me, this, all these things, they are happening, and it is happening from right side and left side. So brain even deciphers. So when you are using stereophonic sound, right, when you are using surround sound, so imagine to what level this process it is going on, right? Say for example, if you go for the Bose system, well, they say it is like that system where you won't be able to figure out where the speakers are. So it is the crest and the trough of both the sides, and you feel like helicopter is hovering over here. However, the speakers, they are on the left side and in the right side. So that's how the sound technology has come up. So when we'll be discussing, say, auditory system, yes, yesterday only someone was telling, yes, there would be so much of physics, because being a medico, you should be able to appreciate that what exactly is the acoustic noise cancellation. You should be able to decipher what are the finest of the systems in the world, sound systems, because then you will be able to appreciate. Yeah, Dolby 7.1, Atmos, right? They all are different thing. But when we talk about, say, even the most advanced is the spatial audio, that which has come into the Apple systems, right? If you just put those AirPods Pro, and then you go for the spatial audio. Spatial audio means the entire music is getting played not on right or left speaker, but it is playing into your head. And when you move your head, so yes, you'll feel like the entire orchestra is moving, right? So that is what is called as the spatial audio. Well, don't ask more questions, because I'll keep on speaking on that, right? So that is called as spatial audio. Spatial is S-P-A-T-I-A-L, spatial audio. One of the very interesting thing, the entire concept changes, right? They are movable bones. They actually move. Yes, that's right. These ossicles, and and because of some infection, when these bones are destroyed, right? In case if they are destroyed, so then artificial bones are created. So what is that excellence, right? If you see that precisely such bones are prepared, they are implanted, and then they are vibrating, and then the person can hear, right? What the technological achievement. So same way, when you change the, when you look at the valves, cardiac valves, artificial cardiac valves, right, you'll be so impressed that this is what is going into the medical industry, right? Medical science, that is so fine. All right, so hyoid bone, so here it is like 6 bones which are for auditory ossicles, 8 cranial, 14 facial, 1 hyoid. Moving on to these 2, which are the clavicles, right? So clavicle, right? 2 clavicles. Just by look, you'll immediately come to know, okay, that's the only bone which is horizontal. Rest of the bones, they are longitudinal, right? These 2 bones, they are the horizontal, but very vital. Put a star, because this is the bone which is actually, whenever you are doing weightlifting, whenever you are punching, it is this bone which is keeping your hand on one side, right? What is called as the cleidocranial dysostosis. In case if this bone is having any problem, if it is not formed properly, then the hand would straight away come like this, right? It is this bone which is keeping the upper limb away, and it is giving you the advantage. It is this bone which is transmitting the entire weight into your long axis, right, onto your spine, from spine to hips, from hips to lower limb, right? So why it is important? Because when person falls, right, so when person falls, there is weight, and that's where there are specific fractures which can occur. One which can occur at the wrist joint, and second very common fracture which can occur in the clavicle, because clavicle is trying to transmit that entire thrust onto your central axis, and in the process it breaks. This is the reason why your bones should be super strong. In case if someone has to take calcium and D3, the cost of those medicines, it is so less, it is so negligible as compared to your bones. It's not costing even 100 rupees. Yeah, it is not even costing 100 rupees. It is that sasta, right? But because we never care for properly, we never care for our diet, and we don't do exercise. By the end of today's session, you'll surely understand that how important it is to exercise. And yes, congrats to all the person, every friend whosoever has said that yes, we started doing exercise. Very good, right? I'm sorry, to all those emails I have not replied, right? I have not replied. But in general, I am telling you that you guys are doing well, because there were about 18, 19 emails about okay, yes, we have started doing exercise, etc. So very nice. Calcium tablets for increasing height, is it true? It works well, definitely, because your bones will say in case if the today you will see epiphysis, which is like a growing end, it requires lots of calcium and D3. So if there is lack of serum calcium, if there is lack of vitamin D3, so that growth would stop. So taking calcium, surely it helps, but along with vitamin D3, right? Remember that they both are needed, right? If any one of is missing, rest of the component is of no good, right? That's why go logically. Don't take only calcium blindly. Both the things are important. Moving on to the clavicle. Clavicle we talked about. Then on the back, right? On the back, there is this bone, right? This bone. That is the scapula, right? Scapula, which is actually creating your back, right? So right scapula, left scapula, right? On both the sides. Regarding pathology, Kaushal, it is the pathology, right? So right now, let's not talk about the pathology. First, let's understand this, right? When we'll be dealing with pathology, every aspect would be discussed, right? So that is scapula, right side, left side. Then in between, this one is your sternum, right? Manubrium sternum. So this is the sternum. Sternum stands for shield. It's like a bone which is like a shield, right? And then we have got 12 pairs of ribs. So 12 into 2, right? So total 24 ribs, correct? And then all the vertebra from the top all the way we go down, right? So these are all that forms our entire vertebral column, and this vertebral column has got 26 vertebra, right? Meet send a mail, because this answer of this question is very personal, right? Regarding any of such things, send a mail. Won't be able to answer right now, as it would deviate our topic. Then for the upper limb, we have got over here, right? That is the arm. That is called as the humerus. So right and left, so we have got two humerus. These two bones, right, in the forearm, they are radius and ulna. Now, one thing I would tell you over here. Say in upper limb, in lower limb, right? In forearm, there are two bones, right? Radius and ulna. Okay. One of the bone is outside, one of the bone is inside, right? One is on the outer aspect, one is on the inner aspect. True. Similarly, in the lower limb, in the leg, right? In the leg, you have got tibia tibia, and fibula. Which one is out, which one is in? Just remember one simple thing. Wherever your thumb is in anatomical position, wherever your thumb is, bigger bone is there, right? So when you are standing into anatomical position, so thumb is outside, thumb is lateral. So this radius is lateral. So ulna is medial. Fine, correct. And let's say in the form of leg, right? Tibia, right? Tibia. So your tibia is a bigger bone. So your toe, big toe, that is bigger. So tibia is medial and fibula is lateral, right? So your toe, big toe, right? And your say in radius, your thumb, right? That is lateral. So you know which one. Now, yes, femur is the strongest bone. That's right. Femur is very strong. So over here is the forearm, right? That's your thumb, right? So this one would be radius. So there would be two radius, and over here there would be two ulna, right? Two bones, two radius, two ulna, right side and left side. Now, for the hand, right? For the hand, this portion, right here. So that is what is called as the carpals, right? Carpals. Yesterday we were trying to remember. She looks too pretty, try to catch her. She looks too pretty, try to catch her. 8 bones. So 8 into 2. So that means we have got the 16 bones, right and left, carpals. After carpals, there comes metacarpals, right? So these are the metacarpals. So metacarpals, that is what it forms your wrist, this wrist, right? So over here, see the mechanism. Those two bones are over here. Here is, those two bones are over here, this one. And then say, if we zoom this, right? If we zoom this, so here are those 8 bones, and these are metacarpals, right? These are metacarpals. So we have got 5 into 2, that is 10 metacarpals, right? On both the sides. Now, say moving on to metacarpals 1, 2, 3, 4, 5 for every finger. 1, 2, 3, 4, 5, right? 5. So 5 into 2, right? 5 into 2. So we have got 10. And then finally, they are called as the phalanges. Phalanges, right? Phalanges, fingers. So we have got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And in thumb, there are 2, 13, 14. Correct? So we have got, say, 14 into 2, right side and left side. So total, this is 28, right? We have got 28 phalanges, right? We have got 21 phalanges. Gentlemen, stop advertising and all these things. Otherwise, I have to remove you. Any of the activity, if it is deviating everyone's attention, I won't permit it. Please don't do it, because it is not so that only one person is studying. The entire group is studying. So please let them focus. Thank you. Right? So these are, so humerus, radius, ulna, carpals, metacarpals, and phalanges, right? So that is phalanges. That's right. So total there are 28 phalanges. Count phalanges again. Very easy. Very easy. 4 fingers, right? 1, 2, 3, 4, 4 fingers and 3 phalanges. See, 1 in between 2 and this one is distal, 3. So 1, 2, 3. So 4 3s are 12, 14 and 15. 12, 13 and 14, right? So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13 and 14, correct? So there are 14 phalanges. So 14 right, 14 left. Once you have understood, rest is very easy. This bone, right, which is called as the hip bone, there is one more name that is called as the innominate. Innominate means जिसका कोई नाम ही नहीं है, who has got no name, innominate bone, because this bone is so strange, its shape is so weird, so they couldn't give the name. So a general name is given hip bone. Otherwise it is also called as the innominate bone, right, who has got no name. So we'll just write hip bone, and when we'll be studying this hip bone, right, you'll find that it is combination of so many bones, right, as it develops. Okay, so that's the hip bone. Once again, as we come down to our lower limb, the strongest, most powerful, that is our femur, right? Very powerful bone. It is this femur which will be giving attachment to the most powerful muscles of the thigh, right? Because that's the reason, say these bones, the lower limb bones, right? Lower limb bones, they are powerful because they are weight bearing. And this is the reason that knee joint is so important, because knee joint is a weight bearing joint, right? So it will be taking maximum weight whatever you are doing. That's why when person gains extra weight, it will start affecting the knees. So if you lose weight, right, your knees would tell thank you for that. Yes, that's right, right? Ilium, ischium and pubis, these are the part of the hip bone. Very true, very true, right? So moving on to this, so there are two femurs. Moving on to this part, that is the fibula. Fibula means something which is feeble. Feeble means weak, right? So this is a very thin patla sa bone. So there are two fibula. Tibia, which is tough, right? So there are two. So when you'll see this bone, right, so that is tibia and the fibula, right? The way over here we were having carpals, and in leg, right, there are tarsals, right? हिंदी में पता है पाँव को टांग बोलते हैं. So that's why say T for tongue, T for tarsals. So now we never miss कि अरे यार tarsal was in the hand or tarsal was in the leg. Tarsal can be in tongue only, right? So it is legs. So there are seven tarsals. So total 14, correct? Total 14. Fibula gives attachment to so many important muscles, right? So though it is not a bone which will be like a weight bearing, right, but it will be giving a very important surface for the muscle attachment. And in fact, tibia and fibula, in between there is interosseous membrane. Remember, interosseous. Interosseous means, osseous means bones. Inter means between two. So in between two there is a membrane, and that membrane also gives support and it gives attachment to so many muscles, right? So yeah, you reminded me one very important part. This is called as the patella, right? That is the kneecap. That's right. I don't know why you keep on doing this thing. Anyone from here or unnecessary, I have to remove you. So that is patella, right? There are two patellas, right side and left side. So tarsals, yes, tarsals are 14, that's right. The way we were having metacarpals, right? Metacarpal was forming the palm. So here we have got this part, our entire foot, right? Apart from fingers, that is will be called as metatarsals, right? Metatarsals. So they will be 5 into 2, right? Those for 5 fingers, so they are 5 into 2. And obviously for the final fingers, so they are called as the phalanges. Phalanges means fingers. So again, same logic. All our fingers apart from thumb has got only 2 phalanx, 2 pieces, right? While rest of the fingers, they are into 3 parts. Yes, I'll show you all the images at a later stage, right? Today we are just watching it in general. Tomorrow we'll be actually watching every image individually. I have divided the skeletal system into 2 parts. Just think it like today you are getting a general idea, and then tomorrow we'll be going in depth. Specifically, we'll watch, right? I'll show you some x-rays also. So that will give you the first glimpse of regarding how to watch the x-rays. Okay, all right. So phalanges, as I said, 14 into 2, right? So that's how the entire skeletal system is so amazingly divided, right? So total there would be 206 bones. So that's what you have to study, right? 206 bones. Now remember, every bone is named. Every bone is named, right? Why carpals are 16 and tarsals are only 14? I have to ask to God, right? Why he did this. Right? In fact, Khushi, we have to ask the God that also, that why the shapes are different. Right? But that's like our human body. But yes, they are interesting. They are interesting. Every bone, the way it is articulated. One reason I can give you, say the movement of the wrist, that is much more finer as compared to the movement of the foot, right? Say these 8 bones, they are small bones and they are so intricately attached with it. So literally, say you can move your wrist into multiple directions. That's not the case in leg. Right? Are these replacement options for each and every bone in the body? Replacement options means in case if it is damaged, so we just put a new bone. But some people have an extra finger. Yes, which bones are then? In that case, obviously, extra finger. So from where it is coming up, most probably they will be having extra phalanges. Extra phalanges. Right? Yeah, pelvic bones, they are the hip bones. Pelvic bones are hip bones. Now regarding the functions of these bones, right? We'll do a brain map. We'll do a brain map. 1, 2, 3, 4, 5, 6, 7, and 8, right? Okay. The first, it gives shape and support to the body. Right? Humerus and femur, the length itself is amazing. Femur is 18 inch, a long bone. Right? Humerus is a pretty small bone. So many differences, but this is one of the biggest difference. But as such, once you'll see those 2 bones, there is a marked difference. Right? So shape and support. Second, it gives surface to muscles, right? Surface to muscles, surface to ligaments, right? Surface to tendons. Now, ligaments, they were like bone to bone, right? You remember that, right? Ligaments are like bone to bone. Tendons, they were like bone to muscles. True. Acetabulum is part of the uh, hip joint, right? It is called as the acetabular cavity. Acetabular cavity in which the head of the femur fits in. So these are the parts of the bone. They are not separate bone, right? Okay, so gives shape, surface, it provides surface, then it serves, it serves, it serves as liver, right? Liver, not L-I-V-E, yeah? Right. Yeah, that's right. Manufacturing blood cells, so that was over here, the last B, right? That was for the blood. So it will come last. So it serves as liver. Liver's function is mechanical advantage, right? It is the mechanical advantage. So due to bones, we can lift heavy weights and we can perform some specific movements, right? Then moving on to the next S. This is, it creates safe space for organs. That means in case of thorax and abdomen, right? So those ribs which are surrounding very delicate organs like heart and say lungs, right? So that is how it remembers, right? That is, it protects. Then it stores, as we talked about, calcium, right? Calcium, phosphorus. Regarding the phosphorus, many times they say कि श्मशान में भूत होते हैं, right? People watch something. Nothing. When the body is burnt, when these bones are burnt, as the phosphorus comes in contact with oxygen, it starts taking various shapes, right? It brightens. Phosphorus, which is used in so many firecrackers. So that's why when the bones are burnt, right? When this phosphorus is burnt, it gives various colors and shapes, and people say, "Arey bhoot bhoot," right? Then the sinuses, the bones which are into the skull, right, into the face, they are having sinuses. Otherwise, the weight of the head would be so much that we won't be able to even move it. So sinuses, these are also called as the paranasal sinus. Remember, para means near, right? Parasagittal, the plane which is near to sagittal plane is parasagittal. Similarly, paranasal, nasal means nose, right? Nasal means nose. So paranasal, surrounding the nose, these are the areas. Sinuses means they are filled with air, right? They are filled with air. So this gives resonance to the voice, because when you say hmm, so that air is vibrating. When try to do this thing when you are suffering from common cold, right? Sound becomes different, right? So these are the sinuses which are not making the skull light, but they are also adding resonance to your voice, right? All those variations, they are giving resonance to the voice. So that's like safe environment. It stores calcium, phosphorus. These are the sinuses. And one more thing, and that is the special cells, right? These are the some special cells. These cells, they are called as the reticuloendothelial cells, RE cells. At this point of time, remember RE cells. That's yes, timbre of voice. That's good, right? Yeah, beauty bone clavicle. True, true. So reticuloendothelial cell, and it has got tremendous importance in our immunity, your immune system. See, for our immune system, the bones are important, right? That is what they really do. And finally, this B is our super blood, right? Super blood. That is what is called as the erythropoiesis. Erythropoiesis, right? Where it forms the important blood. So these are the major functions of our bones. Right? Now let's move on to our classification. If we really want to understand our skeletal system properly, we need to talk about the classification. The moment we'll understand the classification, the biggest advantage would be we'll start understanding every bone in a very from a very different perspective. Bone marrow, we will come to that, but still you have asked, say this is the bone, right? This is a cross section of the bone. The outer one is called as the cortex, right? Outer one is called the cortex, which is tough. In between, inside, right? It is the medulla. Cortex is outside, medulla is what is inside. And in this medulla, there is bone marrow. right? Bone marrow, right? Bone marrow, red bone marrow and yellow bone marrow. So right now we are just talking about this much. After just within 10-15 minutes, we'll come to this bone marrow where we'll be talking slightly in more depth, right? And when we'll be discussing, say, histology, at that point we'll see these slides, we'll actually understand that how they look like, what they really do, वगैरह वगैरह. Okay, so okay, let it remain there. So regarding the classifications, we'll classify the bones in various aspects. First, very simple by looks, right? Shape, how they really look like. So that would be our first classification. Second, we'll see that how do they develop, right? From the development point of view. Development point of view, right? That will give us the insight that this is how these bones, they really develop. Third is the easiest of all, the regional. But regional, yes, teeth are also separate. They are special bones, right? They are considered as special bones. So regional means appendix. Appendicular means upper limb and lower limb, right? So the whole body is divided into two parts. One is the central axis, axial, right? Axial, which is into the center. So that comprises of your skull, that comprises of vertebral column, right? Thorax and the pelvis. And the appendicular. Appendicular means upper limb and lower limb. So starting from humerus and all the way down, starting from femur all the way down, right? So that's how we'll see. And the fourth division, that would be based on the structure. It is in this structure where we'll be talking about this cortex and medulla slightly in more details, right? So that is what is called as the structural. Now, understanding this will give us an insight that when we talk about bones, right? When we talk about bones, so these bones, every bone is how it is so different than each other. Okay, so let's start with our first classification. So we'll just write one, and that is the shape, right? Now in this, the biggest one is the long bones, right? This is the biggest topic, long bones. Rest of the topics, they will be very small. Long bones, why? First one, what is the characteristic of this long bone? Characteristic, right? The characteristic of this long bone is that if this bone, if you really look at this bone, right? Let's take it over here only. So this is the long bone, right? So over here, this is what is called as the shaft, right? And this is another end, right? These are the ends. Now bones, they will grow at both the ends, right? They will grow at both the ends. So this shaft, it is also called as, remember a new word, diaphysis. Diaphysis. It is called as diaphysis. And these ends, they are called as the epiphysis. Epiphysis. Epiphysis means they are the growing end. They are the growing end, right? So that is the classical characteristic of a long bone. So it grows. Your age, at this age, why the exercise, if it is done at a young age, it is more effective, because these bones, they, as we discussed, that these are the live bones, right? These are not dead bones. Chalo, whatever the bone which is given, it is fixed. When you do exercise, it will actually put that stretch on it. It will put the pressure on it. So more the pressure, they are called as the trabecula. Trabecula means there are inner fibers inside the bone. We'll even draw and we'll discuss. But these are the inner fibers. So when those fibers, they are stretched, they make your bone stronger and stronger, right? And that's what makes a tough structure. So when you watch the X-ray, immediately you'll come to know that yes, this is a tough bone or it's a weak bone. And it is this tough bone which will actually make your entire posture. Yes, height also, that is true, right? So that is the characteristic. So I'm just writing, or let's not write anything, I'll just do it like this, right? So that would be done. Another characteristic is, this is where I'm discussing one pathology also, as it is so important, right? It is so important. The thing what is called as the nutrient artery. Nutrient artery. Now what nutrient artery is? Name itself is telling which is providing nutrition. Full stop. The artery which is providing nutrition to that piece of bone is called as the nutrient artery. Now let me change the page and draw something, right? And this is, let's say, hip bone, right? This is the hip bone, and it is this bone where the head of the femur, right? It is connected, right? It is connected. This is femur, and this is head of the femur, head of the femur. This is ball and socket type of joint, right? This ball and socket type of joint. So in hip, right, this is quite deep. This is hip bone, and it is this cavity which is called as the acetabulum. Acetabulum. To make things still more clear, let me take you to this one image and I'll show you what exactly are we talking about. We are talking about this area. We are talking about this area, right? So hip joint, and inside, right, inside there is head of femur, right? So head of femur is deep inside. Why it is deep inside? This acetabular cavity is bigger because in cases of leg, stability is more important. And while over here, watch for this. This is what is called as the glenoid cavity. Glenoid cavity is pretty shallow, right? And in which the ball of humerus, it moves quite freely, because in upper limb, mobility is important. We want to move our hands, right? So mobility is important. In case of legs, stability is important. So when the stability is needed, obviously that ball would be bigger so that the head is trapped inside and it gives support, right? In case of upper limb, right, that is the movement which is needed. So that's why the glenoid cavity, it is shallow, and the acetabular cavity is deep, right? They both are called as ball and socket, but that's the major difference between both of them. Okay, so let's move on to this part where we were discussing something very vital, and that thing is that this is called as fovea. Fovea, F-O-V-E-A, fovea. Fovea means pit, chota sa khadda, right? A small pit, and in this there goes the nutrient artery. Now this nutrient artery which is present over here, if it is snapped, if it is broken because of any of the reason, right, whether it is because of improper nutrition, or it is because of some instability of the joint, or maybe because of some fracture, or maybe because of some accident, right? If it is, yeah, patella is in knee joint, that's right, patella is in knee joint. So over here in this fovea, it is this nutrient artery, right? There is nutrient artery. If this nutrient artery is damaged, right, if nutrient artery is damaged, then it leads to what's called as the avascular necrosis. Necrosis means that tissue is eaten up. Avascular, vascular means blood, sufficient blood. Avascular means no blood. Lack of blood leads to necrosis or the damage to head of the femur. There are 4 stages when you watch it on X-ray, right? There are 4 stages, but when it goes to stage 3 or stage 4, there is only one treatment, right? Stage 3 or stage 4, and that is total hip replacement. You have to replace the hip, right? This joint, right? This hip joint replacement is needed. So as we'll be discussing these topics, you'll come across the x-rays also. And when you see that x-ray, you'll come to know that there would be, this is a bone. This particular bone would be literally this portion that would be eroded. So you'll be able to see the lucency. Lucency means black portion because there is no bone over there. Because there is no bone over there. So because of lack of that bone, you'll see the gap. And at the same time, patient will be experiencing severe pain, right? It's pretty painful. So that is where the nutrient artery, if it is damaged, because there is only one artery which is supplying head of the femur, right? So important. There's just one artery. As such, nothing happens because that artery is not like very loosely attached, right? There is a very nice protection and everything. And when we'll be discussing, when you dissect, so you have to actually pull the head and then you have to cut that artery so that then you can detach the entire lower limb, right? During the dissection. All right. Moving to, so that is the specialty, another specialty of long bone. Avascular necrosis simply means when the blood supply to that organ is damaged, it leads to destruction of the bone, right? Necrosis means destruction. Avascular means lack of blood supply. Got it? Oh, so many muscles. This area is full of muscles, right? Full of muscles. Muscles on every side. That's how it can give stability. Hai na? Okay. So for the long bones, there are some typical long bones, classical long bones, right? Typical, they are called as typical. That is which follows all the rules. So upper limb and lower limb. So lower limb, femur, tibia, fibula, correct? All long bones, right? Involuntary muscles, no, voluntary muscles. You can move those muscles as per your wish, right? We can't run by automaticity, right? We run by activating muscles which are in our control. Involuntary muscles, they are into the abdomen, right? All those digestive system. You can't tell your stomach, यार अभी मैं पढ़ाई कर रही हूँ, so don't digest the sandwich, right? Digest after some time. No, stomach won't listen to that. So femur, tibia, fibula, they are for lower limb, and humerus, right? Radius and ulna. These are the classical 6 long bones. Right? Classical 6 long bones which are typical. Few bones, they are miniature. Miniature. Miniature means they are small, but as such they are long. Which are they? All the bones, right, which are into phalanges. All the bones which are metatarsal and metacarpal, right? Those bones. Because they are long bones, right? But chote chote. So metacarpals, metatarsals, and phalanges. Right? Small bones, right? Classical. One very special bone which we talked about, horizontal bone, right? All these bones, they are longitudinally situated. Only horizontal bone, the beauty bone, that is the clavicle, right? Horizontally situated. So these are the long bones. From the perspective of shape, right? So we just extend this to our next page. Bones, they are in miniature type. Because see, long bone, the femur is so big, but those phalanges, right? Phalanges, so they are like this, small bones, right? They're really very small bones. Ear bones, they are in miniature type. They are irregular bones because there is no specific shape. They are like very strange shapes. So we'll come to that. So it is from the shape perspective, right? Say from the shape perspective, if we do the brain map of this, so we talked about those long bones, correct? We talked about long bones. So if we are talking about long bones, there has to be short bones. Short bones. And all these short bones, they are like all those carpals, right? all those very small bones. So our carpals, right? Then say tarsals, relatively small bones, right? Small bones. Scaphoid, lunate. See, in this much strip, there are 8 bones. So obviously their size would be so small. And there is one bone, right, which is over there. It is called as the pisiform, right? Pisiform, P-I-S-I-F-O-R. Pisiform. Pisiform means it is P, matar ka dana, right? Actually, it is like that. Very small bone, right? Very small bone. But it hurts. Sometimes it gives pain, right? Because it is developing in one of the tendon. And name of is that particular muscle, right? That is in the tendon of flexor carpi ulnaris. Flexor carpi ulnaris. So easy to remember. True? Because we said that this component is the flexor component. This side is ulnar side, and it is going towards the carpal because this is one of the carpal bones. So flexor carpi ulnaris, right? While wrestling. Huh? That's right. That's right. So even when you do it like this, right? When you do it like this, so this particular bone, it moves, right? That is a small bone which keeps on moving, right? Very powerful. Bone is very delicate, but its function is very interesting. So these are the short bones, right? Then there are so many scaphoid. Scaphoid means boat-like. Scaphoid. Say bone, if you see, it is like a boat-like scaphoid. Lunate. Lunate is like half moon, right? Very interesting names. Cuboid. Cuboid is like a cube. So that's how we'll see all those bones. And if you, there are already videos where I have explained all these upper limb into great detail. So if you go through those videos, you'll be able to see each and every bone in tremendous detail. So you can definitely go through all those osteology videos, right? Upper limb, lower limb, they have been discussed. All the regions are there. Next one is coming up is flat bone. The bones which are flat, right? Relatively flat. Say a femur is a round bone, right? Round bone. Phalanges, they are round bone, right? There is a shaft. These flat bones are like say skull. Skull. It is like a plate, right? So they, that is a skull bones. They are like flat, right? Ribs. Ribs, they are like literally patti. Patli patti. They are like flat bones, right? Ribs. That's right. Sternum. Sternum is like a flat bone, right? Because it is just in front over there, right? Scapula, which is back, right? If you really see the scapula, in case if you have got the bone set, if you really see, so it is so thin. But on the outer aspect, that is the inner aspect and the outer aspect, there are big muscles. Literally the entire bone is surrounded by those mammoth powerful muscles. So that is, sorry, that is the scapula, right? So these are flat bones. Then you will come across few irregular bones. Those bones who has got no shape. And one of the biggest one, that is the innominate bone or the hip bone, right? Huge one. That's true. It is combination developmentally. It develops from combination of 3 bones, ilium, ischium, pubis. So when we have discussed that thing into lower limb, so we see that they all are separate and gradually they all merge, right? And then there is formation of one complete bone. There is a big difference. Hip bone is as such very, yes, scapula is triangular in shape. Very right, Richard. Hip bone is so important because when you'll see, when you'll study the hip bone, it actually gives us the idea that why there is difference, say, in the structure of a male and female. So it is one of the biggest, very big topic, that the difference between male pelvis and the female pelvis, right? No, nails, they are just keratin, right? Nails, they are not considered as bones. So they are keratin. Because see, when you cut the nails, there is no pain, right? True, there is no pain. But if the bone is injured, say if there is, you just tap your bone and you will feel as if the current has passed, right? If anyone gets injury on the shin, I think there was one email that say I've got injury when I try to run, I get pain in my shin, right, in the leg. So yes, that is what is called as the runner splint, right? So if there is very minor what is called as the fracture, right? So that can give rise to severe pain. So proper care should be taken. Usually it is because of incorrect form of running, right? So on Saturday, all such questions will be permitted. No restriction. You can ask anything and everything and we'll talk about it. Okay. So that's the hip bone. Then we have got vertebra, right? So vertebra, they are like say this, and then there are transverse processes, right? And so all a completely different shape, right? So these are the vertebra. So that is an irregular bone. Then bones which are into, that's the skull. You cut the skull and then when you watch it inside, you remove the brain, you watch inside to the base of the skull, right? Base of the skull inside, where there are such crazy arrangements, right? Very crazy. That's right, right? Those bones, they are also irregular, right? Ossicles. True. So sphenoid bone. Now, these are the bones which are forming the base of the skull. So sphenoid, then ethmoid, totally irregular bones, right? Temporal, occipital, crazy shapes, right? So temporal, occipital, these are the bones, but they are so beautiful. When you really start understanding about all these bones, you'll find that how nicely God has created the whole structure. Because if it is with some different shape, then there is a reason behind it, right? If you find that in this occipital, suddenly those occipital peduncles, they are so strong, but there is a reason, because it is giving such a nice support on which your entire head is moving when you say no or yes, right? That's where it is. The hyoid bone, right, which is giving protection, right? It is a sort of flat bone. Then comes the pneumatic bone. These are the bones which we were waiting for since long. These are the bones, pneumatic bone. Pneumatic means air, right? Intervertebral disc, they are not bones, right? These are not bones. So they are the disc spaces, cartilaginous discs which are present between two vertebra, and then they give the support, they give the cushion, right? The trouble is when something goes wrong to that, when there is prolapse of disc space, when that disc space, it goes, that disc, interval, not disc space, when that disc protrudes back and it starts touching those nerves, that is where it starts giving so much of pain, right? That is what is called as the disc prolapse. Prolapse means it protrudes into the spinal canal, and that is where the nerves are coming out and it touches the nerves, right? So that's why that nerve, when it is irritated, it gives severe pain, right? Pneumatic, that means those who are having air, right? These are the having air. Yeah, slip disc, exactly, slip disc, right? That's a common name, you're right. Pneumatic, so these are the paranasal sinuses. So say that's the nose, maxilla, right? Maxilla, ethmoid, inside there is sphenoid, over here this frontal. Whenever there is common cold, right, you start pressing this, right? All those are the areas which are those bones, they are filled with air. But when there is collection of fluid because of inflammatory reaction, so it gives headache, it changes your voice, your resonance is lost, it gives you severe headache. And these air sinuses, they are not, say, those cavities which are fake, say, locked. No, they all are communicating, and that's why the fluid which is collected over there, it runs through nose, right? Because there is inflammatory reaction which is going on. So that is where these PNS, paranasal sinuses, right? One of the very fine topic when you go to head and neck. Yes, they are like irregular bones, sphenoid, ethmoid, right? They are irregular. So sphenoid, right? Sphenoid, ethmoid. Tomorrow I'll show you pictures of all the bones, right? All the bones, so that you get a better idea. Plus, we'll be discussing something new. So then maxilla, right? Maxillary sinuses, frontal sinus, right? This is the bone which is present over here. And that's why in common cold, if you press over here, you feel so good, right? That's a reason. Okay, in this, let's finish our one more point, and that is sesamoid bone. Sesamoid bone. Sesamoid means seed-like, seed-like, beach, right? Seed-like, right? So these sesamoid bones. Zygomatic is when Richa, when you are angry, you can tell someone that tera zygomatic tod dungi, right? It is this. When you give a punch, right? That is the zygomatic, which gives the shape of your shape to your face. Parietal is on side, right? Parietal, you won't find those air sinuses into this, right? Parietal, then the temporal. Parietal is here, temporal is here, occipital is on the back, right? Yeah, patella is the sesamoid bone. So now we are coming to that. See, for the sesamoid bone, they are seed-like. Now seed develops in something, right? So now these are the bones which are developing into the tendons, right? They are developing into the tendons. So first one, which is patella, right? Which is patella. Don't ask such questions. Why you're not reading my chat, etc. I'm reading everything, but when the things are going on, I won't deviate in the benefit of everyone. So patella, then the second one is fibula, right? Fibula. And third one, very important, and we have talked about it, is the pisiform, right? So patella, fibula, and pisiform. Now, patella, this is, we talked about, right? It is into the knee joint. So the name of the muscle, right? Quadriceps femoris. Now see, so easy the name is. Quad means four, right? Seps means head. So this is a muscle who has got four heads, and it is the femoral region, that is in the region of thigh. Got it? Right? So quadriceps femoris. True? Now this quadriceps femoris, when we say, right, quadriceps femoris. So four head, it has got four head, and it is into the region of thigh. So which four heads? So easy to remember, right? One, which is called as the rectus femoris. So there is one muscle which is straight, right? This is a straight. Rectus means straight. Rest three muscles, they are very big. So they are called as the vastus medialis, one who is on the medial side. Vastus lateralis, one who is on the lateral side, and someone who is intermediate, right, who is in between. So it is called as vastus intermedius. So got it? You have got vastus medialis on medial side, vastus lateralis on the lateral side, vastus intermedius, which is on over here, and then on top of everyone you have got rectus femoris. Done. And all these four, they are combining together over here, and that's where the patella resides, right? That's where the patella resides. So this is how, because it is giving not only the attachment, but also it is giving the direction, right? So that is the patella, very important bone. Then regarding the fibula, in the calf muscles, right, there is a muscle called gastrocnemius. right? It is C is silent, so it is just said gastrocnemius, right? And not the gastrocnemius. So it is the gastrocnemius, and there is a lateral head and the medial head. So this will go into the lateral head, right? And that is where it will go. This particular bone is over there. And in the PC form, we talked about it is the flexor, right? Carpi ulnaris. So that's the name of the muscle where the pisiform resides, right? So these are the three sesamoid bones. Apart from these bones, there are few bones which are not of much importance, right? Normally no one would ask you about those bones. Say some of the bones, they are the accessory bones, right? Accessory bones. They are also called as the supernumerary bones, right? This is only from the theoretical importance, supernumerary bones, and especially in radiology, if you look at these bones, they might give you that is it a fracture, right? They might say, you might feel like that it's a fracture. What happens is that when the bone is formed, now these small bones, when they are getting formed, if one of the epiphyseal center is not joined, so it remains separate, right? It remains separate. So small portion of the bone, it remains separate, and you feel like it is a fracture, right? That's why you should really be aware about these bones. So especially the sutural bones, right? Sutural bones in the skull, right? In the skull, when these bones, there is fontanelle. Fontanelle means it's a space. When the baby is born, right, there is a space. Then gradually, as the skull becomes bigger, as the brain grows, so when the skull is of full size, then all the bones, they lock themselves, right? They are ossified. So then the size of the skull is fixed. Till that point, because the brain is growing, so skull also keeps on growing, right? So that these are the sutural bones, and in between sometimes if anything goes wrong, so small bone which would be lying independently, so that bone is like such sutural bones or os trigonium, such bones, they are present and they are called as the supernumerary bones, right? And finally, we have got some, so because of some profession or because of, say, for example, one bone which is called as the rider's bone, right? Rider's bone. Now, as such, it's not bone, but it is an abnormal ossification, right? Abnormal ossification. This abnormal ossification, it occurs because when the person is riding, constantly riding, right? For those riders. So in the adductor muscles, because of the pressure, it leads to some abnormal ossification, and it comes like a hypertrophic bone, right? This is hypertrophy of soft tissues, right? Soft tissues, they become hypertrophic. Quadriceps femoris holds the patella, right? See, basically quadriceps is, patella is inside, so patella definitely provides the surface for the quadriceps attachment, but the quadriceps is a big muscle, right? Patella is, and entire force would be directed towards it, and then from patella it would lead to attachment to the tibia. So when we'll be learning about this say lower limb, you'll find that along with the surroundings, patella, yes, it gives surface for the attachment to quadriceps femoris, right? So you are not completely wrong. No. All those sesamoid bones, remember one thing, right? Remember all those sesamoid bones, they give the direction and they give you the surface, right? Rider bone, it is just the ossification of soft tissue, abnormal ossification of soft tissue. Normally there is no bone over there, right? Normally there is no bone over there, but because of the constant pressure, right? Some of the soft tissue, it gets ossified, and that is what is called as the hypertrophic bone or heterotrophic bone, right? Say these tibia, fibula, they are attached to patella. As such, patella, the location of the patella is classically, it is on to the femur, right? The attachments, because it is like a freely mobile, right? It is a freely mobile. It is for the locking of the knee. So when we'll be discussing lower limb, the importance of patella is to lock the knee, right? So that person can stand with a locked knee without use of muscles, right? In army, when people are standing for long duration, so it is the lock knee. Once the knees are locked, the pressure on your muscles, it goes away, right? That is one of the very fantastic mechanism. So once the patella is removed, maybe because of some accident or any of the other reason, so this person won't be able to lock the knees, and sometimes as the muscles are tired, immediately they'll tend to fall, right? So that's how the whole system, or that's how the, say, muscles they work, or this patella works. The second, now we go slightly fast, right, because we need to cover some ground. The development part, the second type, right? Fibula is on the back side of the knee, right? Fibula is in the back side of the knee. I told you that it is in the lateral head of gastrocnemius. Gastrocnemius is what really gives shape to the calf muscles, right? That calf muscle. So if this is the knee, we are watching from the side. So this is on the lateral aspect. So there is a muscle called gastrocnemius because its shape is like stomach, right? Gastrocnemius. So that is where it is formed, right? Accessory bones, they are extra bones which are present. It is onto the medial aspect, this rider bone onto the medial aspect. Moving on to the development part, very easy. One, the development, whether it is in the membranous development or it is the cartilaginous development. Cartilaginous development, right? Membranous development means they develop into the layers, one by one layers. So all flat bones, they are membranous. So skull, right? Face, facial bones, they are membranous, right? When we'll be discussing, say, embryology, so at that time, we'll also be discussing mesenchyme. So what are the various tissues and the cells from which things develop? So right now we are not entering into that detail, right? But these membrane bones, they are a bit special. Cartilaginous, almost all the bones, majority of the bones, they are by this preformed cartilage model, right? It is the cartilage model. How the bone would really look like, the cartilage is formed, and then gradually as the age increases, it starts getting converted into the bone, right? So all the bones of, say, upper limb, lower limb, vertebra, right? Vertebra and the thoracic cage, your ribs, right? All those bones, right? They are cartilaginous bones. And some of the bones, they are combination, right? They are like membrano cartilaginous. So it means it is combination, partly membrane, partly cartilage. And the beauty bone is the first to remember, clavicle, right? Clavicle is a combination bone, right? Similarly, the mandible, right? Mandible is a combination. Occipital, this backside, right? Occipital, right? Very, very important bone, occipital. Then temporal, right? Temporal bone, right? Over here, temporal, that is combination. And when we'll be discussing head and neck, the sphenoid bone, one of the beauty bones, the bone which looks like a bird, right? That is sphenoid. That is also a membranous one, right? Plus, few bones which are called as the visceral bones. See, most of the bones, they are for the body. Few bones, they are having very specific, say, function. In embryology, we'll come across what is called as the pharyngeal arch, pharyngeal arches, right? Pretty interesting, but slightly complex topic, pharyngeal arches. But just remember it this way, that pharyngeal arches, it leads to two important bones, right? One is hyoid bone, and second, it is the ossicles, auditory ossicles, right? I'll write it, auditory ossicles. So these auditory ossicles, malleus incus stips, right? That's how they move. Is mandible bone some? Yeah, mandible, your jaw, lower jaw, that is mandible, right? It is movable. Otherwise, we won't be able to speak also. Okay, so this was our second classification, that is the developmental. The third one, that is the easiest one, the regional one. Correct? That was our third classification, the regional one. And in regional, as we said, axial and appendicular. 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 Right? Remember the word. Appendicular means which is about something which is projecting out of the body. So here it would be upper limb and lower limb. Right? Upper limb and lower limb. Axial means something which is in the long axis, which is into the axis of our entire body. So in axial, it would be simple, right? Skull, right? Then the entire spinal cord. So that is our vertebral column. True, our vertebral column. And then the thoracic cage, right? Thoracic cage and the pelvis, right? Finally, the last classification, which was based on the structure, right? Yeah, butterfly shaped sphenoid bone. That's right. It is butterfly shaped, right? Butterfly or bird shaped. Structural classification, that was like our fourth different type of classification, right? In structural, if we go for macroscopic is something which you can watch with your eyes, right? You just watch, you don't have to really go for the microscope, you just watch it, and you divide it into two parts, and that is what is called as the compact bone, right? Compact bone. Hip bone will be coming into the axial, right? The way thoracic cage, so scapula, everything is coming into axial. Upper limb and lower limb, right? From the humerus and from the femur, they are into the appendicular. So compact and spongy bone. Compact and spongy, right? So when we say compact bone, that is the shaft, right? That is the shaft, middle portion. So it is called as the diaphysis. Just for the reference, this is the diaphysis, and this end, right? It is the epiphysis. This end is the epiphysis. So long bones, they grow at these ends, and this is the diaphysis, which is also called as the shaft or the middle portion. This is compact, right? This is compact. This is tough. It is compact, right? These growing ends, they are spongy, because if they are flexible, then and then they can grow. So it is called as the epiphysis. Epiphysis, remember, growing end, right? That's the area which will keep on growing, right? And because it is growing, it would be susceptible to various types of forces. So those forces, if the muscle is really pulling, so yes, the size of that bone would increase. You must have noted in Africa, as because they say that female is beautiful if her neck is long. So just after the age of about say 6 or 7 years, they'll start putting the rings around her neck. So those rings, they'll keep on stretching their neck, right? So you'll find those in some say African those tribes, females, they are with long neck, right? Because they keep on putting those rings on and on and on. So that's why their vertebrae, right? They are literally pulled, and they develop long necks, right? Simply same reason, compressive forces, they are pulling them, right? They are shear forces, so they lead to development of, that's how the bones mold, right? And in compact system, say when we say inside there is bone marrow, right? Inside there is bone marrow, inside there is bone marrow. So till the person reaches to puberty level, right? 16, 17 age, there is red bone marrow. So red bone marrow till puberty. till puberty, right? There is red bone marrow, so it produces RBCs. After that, it gets converted into yellow bone marrow, which is having fat, right? However, the epiphyseal end, they are having red bone marrow, and they keep on generating the RBCs, right? As we discussed that compact bone, it is hard and it is ivory, right? Hard and ivory, solid bone, and the growing end, that is bit spongy, right? That is spongy. And this cortex, right? The cortex, that is tough. Bone formation. Remember, this bone formation is directly proportionate to, say, strain. That is when you do the exercise, power, right? Stretch. So it improves the bone ossification. So all these forces, they will help for the growth of the bone. Quickly we pick up just two small things. One, the force which is called as the tensile force, and second is what is called as the compressive force. See, when you are doing weightlifting, right? So it is a compressive force. So it means there is so much of power which is exerted on it, right? And then tensile when it is really pulled. So there are trabecula. Trabecula means these are the fibers. Trabecula. You can consider that these are the fibers. They arrange themselves. They are arranged in such a way so that both these forces, they are handled properly. If the bone is weak and it cannot handle this pressure, bone breaks, right? This is the reason why exercise keeps your bone strong, because it takes care of these trabecula. Now these two type of pressures, these are the pressure lamina, compressive forces. For the compressive forces, you can say these are called as the pressure fibers or pressure lamina. Lamina means sheath, right? Lamina is sheath. So these are parallel. These are parallelly arranged, right? Parallel to forces. So when the direction in which the compression is exerted, right? The direction of fibers, it is parallel. And when it is pulled, tension, right? It is pulled. So these tension lamella, they are perpendicular to forces, right? Just remember this much, right? As because this is just for the understanding part, right? It is for the understanding part. If you really see that when we really draw, right? When we really draw that, okay, this is head of the femur, so you will find that those compressive lamella, right? They go like this, say longitudinal, right? They go like this, right? They are long axis of the body. But when it comes to those tension, so that is this head should not break, so they will be almost arranged like this, right? They will be arranged like this. So these are tension lamella and these are compression lamella. Finally, we talked about the macroscopic, and this is the microscopic, what you see under the microscope, right? So lamellar bones means which are developing into the form of layers, right? So they are into the form of layers. Then few of the bones which are like, they are called as the woven bones. So nothing happens to that bone as such, but wherever there is any, it gets developed into that much area. Say for example, best example is the fracture repair. So wherever there is fracture, gradually you'll find that area is active, it keeps on working, and that bone is properly healed, right? Say for example, carcinoma, cancer of cancer of bone, right? So there is uncontrolled growth in that specific area, right, which later on spreads. Small fetal bones in case of, say, fetus, right, it happens. Rest of the bones, like say fibrous bones, in human body, so there are very less. Only in young baby, young fetal age, it develops. Otherwise, such bones they develop in case of snakes, right? Which are called as the reptiles. So snakes, turtles, that's where it develops. And here is, say, dental, right, teeth, right? These are all called as the various cement, right, which forms the tooth. So they are like special ones. White lines on the head, these white lines, they are the compression lamella, right? These are for the compressive forces. They are compression lamella. This is more or less like a theory, right? When we'll be studying the muscles, at that point you will see that how the muscles really support the entire joint in this particular fashion, right? So this that's it for today, right? This much is for today. Now let's go for, because I got the emails that please don't skip the revision. All right, we'll not skip the revision. We go for a super high speed revision, right? And that's how you will be doing it today and today night before you go to sleep, and tomorrow's morning as you wake up. All right, let's start the timer. We'll definitely be finishing within 5 minutes. Let's start the time. Here it is. So skeletal system, right? Bone, cartilage, right? It is a sort of connective tissue. Osteopenia, yes, we'll be watching the x-rays. Thin bones, right? Thinning of the bones, that is osteopenia. And serum calcium and vitamin D3, they are important to check because of calcium salts, phosphate and carbonate, right? Fracture, that's a symbol of fracture, right? Constant turnover of calcium, it comes, goes, fracture, and that's how fracture heals. Bone grows, bone changes its shape. If you don't use one specific bone, so gradually it atrophies, its size becomes smaller. If you start using your bones properly, so it hypertrophies, they become much stronger, because bones, they are extremely regenerative. They have got tremendous regenerative power. Only blood is better than it, right? So yes, body language and your structure is important. So here are the all the bones, right? Go through the cranium, face, hyoid bone, clavicle, right? Then the scapula, yes, these are the bones. Ribs, 24 ribs. Vertebral column, 26 vertebrae. 2 radius, 2 ulna, right? Hip bones, femur, tarsal, metatarsal. Important thing to be remembered, we'll put the tarsals, they are 14. So let's mark it. Tarsals, they are 14 because we can easily forget it. Face has got 14. Cranium is 8. Otherwise, how many clavicles? Without reading, you can really tell. Vertebral column, don't make the mistake. Everyone knows that there are 24 ribs, so that won't be a problem. In carpals, there are 8 into 2. She looks too pretty, try to catch her, so that way we can remember. Phalanges, they are 28. Otherwise, rest all is easy, self-explanatory, correct? Upper limb, lower limb, right? Forearm, this was the concept that wherever the thumb is, that bone is bigger. This is a big bone, right? This one is a big bone. Same way, this tibia is a bigger one, right? Function, all S. Shape, supports surface to ligaments, tendons, muscles. It serves as liver. It creates a safe place for delicate organs, thorax, abdomen, stores calcium, phosphorus. Sinuses, paranasal sinuses, they are filled with air. Special cells, reticuloendothelial or the RE cells, which are meant for immunity. And finally, the blood, that is erythropoiesis. Right? These are the major functions. Classification based on the shape, development, region, and the structural classification. right? From the shape, long bones, these are the typical femur, tibia, fibula, humerus, radius, ulna, done, right? Miniature, they are the smaller ones, so all the bones of palm and the foot, metacarpals, metatarsals, phalanges, clavicle, which is beauty bone, horizontal, good one, and it is the nutrient artery, we must remember, because that nutrient artery, in case if anything goes wrong, can lead to avascular necrosis, right? Epiphysis, growing end, and shaft, that is the diaphysis. Point to remember, this is where we talked about avascular necrosis. A means no, vascular means no blood, no blood, necrosis means when it gets destroyed. We learned two names, acetabulum, right, over here, and the fovea. Fovea means a pit in which it goes, right? Here is the shape. And long bones, then we talked about short bones, carpal tarsals, and then flat bones, skull, rib, sternum, scapula, irregular, to all the way hip, vertebra, sphenoid, ethmoid, temporal, right, occipital. Pneumatic means these are the air cells, PNS, paranasal sinuses, sphenoid, ethmoid, maxilla, and the frontal. Sesamoid bones, three things to remember. Patella, which is into the quadriceps femoris, fibula, which is into the gastrocnemius, that is into the calf, and the third one, pisiform, which is into the flexor carpi ulnaris, right? Quadriceps, four muscles, right? One rectus and three vastus, medius, intermedius, lateralis. Accessory supernumerary bones, which are developed because of some sutural bones are there and they can mimic like fracture. Rider's bone because of constant pressure. Development, either cartilage, membranous, or the combination. So membranous, which are like flat bones, skull and face. Cartilaginous, right, upper limb, lower limb, almost all the bones, vertebra, ribs. Membranous, these are special, membrano-cartilaginous, because these are the mixed ones, right? Clavicle, mandible, occipital, temporal, and sphenoid. Visceral, again special, hyoid, and the ossicles, right? Regional, axial, appendicular, you know it very well, right? And finally, the structural, macroscopic, compact, and spongy. This is the important point to remember. So compact is diaphysis, which is strong. Bone marrow is red till puberty. After that, it is the yellow bone marrow, which won't be producing RBC, but it can produce RBCs, right, in case if it is needed, right? That is when we go into more detail of that. And the epiphysis, which is growing end, and it is spongy, right? Bone formation is directly proportional to strain, power, stretch. Tensile strengths, right, they are perpendicular, and compressive fibers, they are parallel, right? So that's the figure in which we saw that. Otherwise, rest of the bones, they are like lamellar woven bones, which are for repairing or cancer, or some fetal bones, fibrous, which is of theoretical importance, some young fetal bones on the reptiles, dental and cement, they are the for the tooth, right? 5 minutes and few seconds above. So that's it for today, right? Do revise the things properly, and tomorrow we'll not only watch more amazing figures about all the bones, but we'll be adding something to this in our skeleton system part 2. Okay, thank you so much and see you tomorrow, same time. Yeah, thorax, I know, right? Just I'm managing it slightly, right? Give me 2-3 days and we'll be on track. Yes, that's right.